ventilator-associated pneumonia, and high alert medications. First, we'll look at how the bow tie functions. Second, the thinking involved. Third, how you can use this method to study. Fourth, how to answer this question type on NCLEX. On screen, you'll see the steps of the clinical judgment measurement model. The bow tie item is the only question type that uses each of these steps together. The event is placed in the middle of the screen or paper, while the measures to control risk are placed to the left, and the recovery measures are placed to the right. It's used for testing nurses, is not much different. Here are the steps. First, read the scenario, then understand what the client may be experiencing. Next, identify solutions to the experiences and consider the most likely cause. Finally, determine appropriate actions and the parameters to monitor after those actions are done. Let's look at a condition that is common, simple, and often treated initially without worrying about the cause or all of the scenario: acute hypertension. So let's say this person is hospitalized, their pressure is 210/110, and they're experiencing chest pain and shortness of breath, both from decreased cardiac perfusion. Place the word hypertension in the center of your paper. Now generate actions for reducing the blood pressure. Let's say action 1 is administer a labetalol bolus, and action 2 is start a labetalol infusion. Those go to the left of the condition. On the right, which two parameters do you need to monitor? The first is obviously blood pressure, right? You want to see that it starts to go down, and you also want to make sure the client doesn't get hypotensive. Labetalol has a few side effects you might monitor: dizziness or nausea. The client has shortness of breath and chest pain. You might watch for those to correct. What is one thing that helps monitor both of those symptoms considering their cause? An EKG or telemetry. You may only see one of these on the NCLEX exam, if you see any at all. When you see this type of item, there will be some medical record type information like nurse's notes or provider notes, doctor's notes. This will likely include the reason the client is seeking care, some assessment data, vital signs, and maybe some labs. It's not all relevant to the question though. This information is there to mimic the amount of data that would be available to you on a real client. Next, there's a question or direction, such as use this data to prepare for providing care. Then the potential conditions are in the middle. The NCLEX may now ask you to consider a diagnosis for this person. On the left are those actions you might take. On the right are the parameters you might monitor. From each of these columns, you will drag your choices to the empty boxes and drop them. Several things will be left intentionally unused in those columns. Just proceed to the next item when you're done.